one area a lot of people struggle with, if it's affected for them, is communication. And after your surgery, you woke up suddenly unable to communicate in the normal way. What was that like?
I don't think anything can prepare you for the impact that's going to have. So you're told you're going to have a tracheotomy and you won't be able to talk. So yeah, I bought a pad and a pen and took it in with me. But actually, when you come round initially, you're not in any condition to talk. So it doesn't hit you immediately. It's, you know, a couple of days in when you feel you want to communicate, because up until then you're on that many monitors, everything is done for you. So in terms of, you know, the nursing staff and the doctors, they seem to talk to you in a way that they assume what your question is going to be, which is really useful. So actually there's very little. I remember them saying, so you'll be thinking now, and you can nod and say, because they, you know, it's their day job to them. When it comes to, I mean, with Catherine, what we relied on was texting. So 5 years ago, yes, we hadn't quite moved on to smartphones then, but it was the old Nokia and that, and we quickly established that as our main means of communication. You then find you can start to be manipulative with the tracheotomy, and you find ways to make noises, and then you find different ways to make words. And one of my visitors was my niece, who was just training to be an infant school teacher. And what's interesting, because dealing with infants, their communication skills are not developed, you can pick up really early what people are trying to say. And she was almost at times on visits acting as a translator. But texting was the key bit. So not only did it, you know, between myself and Catherine and my daughter, and my mother and father, but actually just people at work and friends, and I guess now you'd just be posting stuff on Facebook. So, you know, use whatever method you can as an alternative.
Did you go out without yet being able to communicate in your normal way?
No, so by the time I was discharged, the tracheotomy had been removed. My voice wasn't as strong, and I was still getting it back. So you were a bit wary of, you know, asking for something, of how your voice would hold up. But no, because I was discharged without the tracheotomy, it wasn't a major issue.